morning, good afternoon, if you're in Europe, and maybe even good evening if you're listening to this through YouTube, recorded after the fact. I'm Malcolm Hawker. I'm the host of the CDO Matters podcast, and you are watching a live version. We're recording this at 11 o'clock Eastern on Friday, late August 2025, and we are absolutely thrilled that you're joining us. Hey, speaking of being thrilled, I'm thrilled to be joined by Dr. Amy Berk, who is, and I need to get this right, the Director of Population Health and Value-Based Care at Microsoft. Dr. Berk, thank you for joining us.
Thank you so much. And it's really a pleasure to be here. And I look forward to having a robust discussion today. So thank you for hosting.
Awesome. So this is a little different for us, Dr. Berk, in that, usually on Fridays when I do these live events, it's me ranting about certain data and analytics issues, AI-related issues, data management-related issues, of course, MDM. I work for Profisee, an amazing provider of MDM software. So this is a little bit of a departure for us, but I'm excited to have a fun conversation today. Thank you for taking time out of your busy day to be here. It's going to be good. We're going to just see where the road takes us. Obviously, We're going to be talking about healthcare related things today. We're going to be talking about data in healthcare. We're going to be talking about the things that healthcare practitioners care about, or data people in the healthcare world talk about. Since it's a live event, and if you are joining us live, you know who you are. Hey, ask questions. There are two ways that you can ask questions. Up in the top right interface here, you can see a messages section or a chat section. Either's going to work fine. Most of the fun stuff happens in the chat. I'm just looking now. We've got folks joining from, oh my God, VJ from London. Thanks for joining, VJ. Paul, a regular visitor, joined from Rotterdam in the Netherlands. Where else is everybody joining from? We've got Amy from York, Pennsylvania. Thank you for joining, Amy from York. Another Amy on the line today.
Oh, Morocco.
Yeah. Gilbert for Irmo, South Carolina. I've not heard of Irmo. That's cool. So thanks everybody for, oh my goodness, we got somebody from Casablanca, Morocco.
I know.
That's cool. I've been to Marrakesh. Have you, Dr. Berk, Amy, have you ever been to Morocco?
I've not been to Morocco, but I've been to the United Arab Emirates. I've been to Jordan. I've been to Israel. So I've definitely been in the region, but never to Morocco yet.
I mentioned I've been to Marrakesh. Morocco is absolutely magical. Murad, thank you for joining us this afternoon. Well, there's Srinivas is joining from UAE, from Dubai. Thank you, Srinivas. Awesome. So Amy, we kind of do this at the beginning to allow people to join in and we gain some momentum and just having some fun and saying hi to folks who are joining from all around the world. I've yet to go to Dubai, but it's certainly on the list. Hey guys, don't be afraid to ask questions if you've got them. We're going to dive in here in a minute or two. Amy, why don't you take some time though to share with everybody your role at Microsoft and what you do?
Yeah, absolutely. And maybe I start with how I got here, right? Because I think the experience is really important. So I am an advanced practice nurse. I have been a nurse for 32 years, a proud graduate of with my bachelor's at University of South Florida, or as I say, the University of Sun and Fun. And then I went on to Emory and did my master's, and I just completed my doctorate at Emory as well. So I started my journey as a cardiothoracic ICU nurse at the bedside for 10 years at Emory. I moved on to a career in management consulting in healthcare for 15 years. So I, during my tenure as a consultant, did projects across operations, strategy, policy, technology, worked in private and public sector, worked domestically and internationally. And I've also then took a directorship as a director of Medicare Advantage and Duals programs for a regional health plan in New England, and which effectively is population health, if you will, because the framework of which health plans for medical management work by is population health. And then I came here to Microsoft, and I've been with Microsoft now for almost 5 years.
So tell us more about your role with Microsoft.
Yeah. So my role at Microsoft then is to work with our strategic customers, those that are health plans, providers with ACOs, on mapping out the art of the possible as it relates to embedding Microsoft solutions and our partners' solutions to really effectuate on population health, quality, and value-based care strategies, initiatives. And a lot of that then comes back to data, as you said before, Malcolm, right? It's really dependent upon having a unified data ecosystem, a platform that is going to not only unify data, but prepare that data, because data integrity is so essential as we think about accuracy, especially as it relates to patients' lives, right? Data accuracy is prime importance. Ways in which we can drive decisions with data to effectuate better outcomes, whether they be clinical, operational, or financial, because we know that healthcare is a combination of all of the above, in which I just mentioned. Integrating social determinants of health data is extremely important as well when we think about whole person care. And ways in which we can really think about enhancing and optimizing quality via digital quality initiatives now, because the landscape of quality is changing to one that's more digital. And as I think about value-based care, as we think about provider network optimization, as we think about interoperability for better payer-provider integration, right, with data, the exchange of data. So these are, what I'm focused on and interested in. And then, of course, the ways in which that unified data platform can be a launch pad for AI and agentic AI, right? Because that is where we're seeing industry going towards. So that's what I do at my role.
Wow. That sounds like a lot. I'm just impressed in just kind of the scope of the things that you are, for lack of a better word, consulting your clients on. Is that a good way to describe it, where you are kind of consulting and acting as maybe even a thought leader for your clients on how to better leverage these technologies to drive the outcomes you're talking about?
Yes, that is the perfect way to think about that, right? And really, I think too, it's a partial in part to me that we're thinking one step ahead of our customers, right? Really being innovative and having the fortitude to know what's next with solutioning, technical solutioning that can really optimize on their endeavors. And whether those initiatives align back to regulations, because we know that healthcare is very much tied to industry regulations, or if that means an opportunity to really co-develop something new for the market, right? That's the perspective that I bring.
So, wow, there's a lot there to think about in terms of our discussion today. I want to also keep in mind, if you within the audience have got specific questions, let's hear them. There's so much I just heard there. One I heard regulatory, right? Of course, we're in healthcare, so we need to be mindful of regulatory. And it seems like that is a highly evolving space. We can certainly talk about that. And the data needed to stay abreast of some of those regulatory pressures. I heard that. I heard AI, right? Everybody's talking about AI. I heard about value-based care, of course, right? And how we use data to enable value-based care. Value in and of itself is a bit of a loaded term, and of course that's going to be an outcome of better data. I heard sharing of data, like that, and how do you facilitate sharing of data? How do you even do simple things like having common definitions of things? How do you create those sharing ecosystems through amazing technologies like Microsoft or Profisee? So many things we could start with. Why don't we start with the elephant in the room? AI, and not the regulatory stuff. AI. Everybody's talking about AI. What are you seeing as some of the things that your clients are focused on now? Is it integrating of like chatbots? Is it like chat agents to help with specific healthcare tasks? Are there like are there like agents now showing up on the iPads of people who are standing beside the bed and kind of helping with diagnostics in real time? What does it look like from a lot of your clients?
Well, it is a variety. And I would say, though, when we think about AI at its core, um, predictiveness is extremely important, right? Ways in which we can be more predictive in terms of care management workflows, in terms of clinical journeys as a whole, right? Um, when we think about AI in terms of risk stratification, right, as in population health, that's a core activity where we are segmenting the population by risk, so we can better effectuate on outcomes, right, where we know what to intervene, more targeted intervention, if you will. When we think about AI, there's a lot of talk now about agentic AI. So our customers are thinking, through how they can use agents, and terms of prior authorization. When we think about agents for care orchestration, right, care navigation, optimizing on utilization management. So those are some of the priority workflows that I've been seeing around agentic AI. Tumor boards on the provider side, right, where we can use agentic AI for tumor boarding and so forth. Closing gaps in care, agentic AI can facilitate, right, for care gap closures, which is extremely important as we think about quality, right, and enhancing quality initiatives. So those are some of the priority use cases that I've seen, and have been talking about with customers. And also, as we think about the patient experience overall, that experiential factor, ways in which we can use AI for a better experience, more engaging of an experience with the health plan, with the health system. So those member-facing, patient-facing applications, if you will, become prominent for that experience using AI and generative AI to really enhance and fuel, that engagement.
Yeah. Well, so wow, things are moving pretty fast. The way that I look at this in many ways is this is kind of a multi-layer cake. And in many ways, some of those agents and what you're seeing through agents that are increasingly being exposed through platforms like Teams and others, to me, is very much the icing on the cake. But the deeper layers of that cake are all the data that goes into helping make sure that the agents are not hallucinating, that the agents are actually accessing the correct provider data, accessing the correct patient data or diagnostic data or payment codes, who knows. The base layer of that cake is where Profisee lives and breathes, and where I kind of come from the problem, which is accurate and consistent data related to your providers and to your patients and to all the things that you're talking about. That data is what we call a master data. So when you're talking to your clients about, okay, this is where we want to get to, right? A lot of the things you're talking about from an objective perspective, how many of them are getting into the depths of understanding things like, what does it mean to run Microsoft Fabric? What does it mean to run within Azure? What does it mean to connect all these pieces? Are you getting into those levels of discussions as well?
Yeah, we do. I think that's becoming more prominent of a discussion, right? The integrity of the data, where the data persists, right? The surfacing of the data at the right time, that's really important to drive those decisions. So that is, those conversations are happening, especially as we think about the use cases that data facilitates, right? And as I mentioned before, I think one of the most prominent and interesting use cases as of late is around digital quality, because we're going to have to be digitizing quality from an exchange perspective of closing gaps in care, right? And that's dependent on data that's exchanged between payer and provider, and surfacing that data in more real time. And that depends a lot then on the integrity of the data, because accuracy is so important, to your point.
Yeah, and it depends even on things as simple as common definitions or common quality standards or common integration patterns. And this is the role that MDM can help play within these complex data ecosystems. Things like having a common definition of provider or common definition of payer, common quality standards, so that when I'm looking at something, I know that Joseph Smith and Joe Smith are actually two different things, and I can be confident in saying that they're two different things, or maybe they're one thing. That's again, this is the role that a Profisee or an MDM would play in this ecosystem. When you're working with your clients, what does adoption look like? Are you seeing widespread adoption? Are you still seeing kind of reluctance? Is it all over the map, or is there certain providers that are ahead of others? What does that look like?
I think it's a little bit of all over the map, right? Every customer is at a different level of maturity, if you will, with their digital journey. I think that there are those customers, a majority of our customers are more mature now, right? Digitally speaking, but there definitely is room for the optimization of data. Oftentimes our customers' data is siloed, right? So bringing data together, the unification of data becomes important because really to be able to meet the goal, the objective of facilitating improvements of health outcomes by reducing total cost of care, that's extraordinarily complex, right? And that data state becomes extraordinarily complex, fragmented data. So getting data in one place to have the opportunity to examine data cross-dimensionally, if you will, right, becomes, I believe, the priority, the remit, right, for organizations. And that's dependent on that unified data estate, right, and getting data where it needs to persist and being able then to aggregate data, normalize data, and accurate data, right, becomes the goal, to be able to cross-examine data in its form between operational, clinical, and financial.
I love it. And the way that I kind of describe this is that there is a physical, again, maybe another cake metaphor. Maybe apparently I'm hungry. Talking about cakes. Well, I just switched to a no carb diet. Maybe I'm just fascinating. I'm like obsessing about I need cake and beer. The way that I look at this is that there's very much a physical layer here when we're talking about breaking silos, right?
Yes.
About creating the interoperability that you're talking about, and like creating the sharing that you're talking about. There's a physical consolidation, and this is what things like OneLake and Fabric are so good at, right?
Absolutely.
Is creating that one physical piping, right?
That's
where everything is riding on the same infrastructure. This is why I'm unbelievably bullish on Fabric, because Fabric is going to give you that kind of that administrative pain to be able to manage all those silos. But not only is there the physical layer, but there is also a logical layer sitting underneath it. That's where Profisee lives and breathes. You can put all of your provider data in one bucket into OneLake, but if you don't know that Jonathan Smith and John Smith are actually the same person and should have the same provider ID or should have the same payer ID or whatever it is, that's what I mean by that logical layer. That's where Profisee is connecting the dots. When you do that in the logical layer within the same physical layer, that's when the magic can happen. That's when you've got the interoperability. That's when you actually start breaking down some of those silos that you were talking about. So these are things that actually we're seeing in the market. These are conversations that we're having as well. And like I said, I guess my allegiance to Microsoft kind of shows through here, because I think that they are so far ahead of other providers in this regard. When we start talking about things like Purview as a catalog, we start talking about Fabric as this virtualization layer to enable everything to plug together. And then you layer on the analytics and you layer on data science on top of it.
And not to mention security, right? The wraparound security, which is so important when we think about patient data, right? And the regulatory initiatives around privacy, right, for patient data, security for patient data. So we are at Microsoft, we run on trust, and security is top notch above everything else that we do.
Well, that's a good segue into, we won't forget AI, because it's still, that's a good segue into some of the regulatory pressures. What are some of the things that healthcare providers are really focused on right now? What's coming down the horizon? Are there things that people are investing heavily on from more of a regulatory perspective?
Yeah. So first and foremost, on the health plan side, we're seeing an uptick in prior authorization, real-time prior authorization, because of the CMS mandate, right? And that's coming due soon. So prior authorization has been a big focus. I'm certain that most everybody has seen that in the trade journals and out there in all the literature, where our health plans and providers are exploring ways in which we can better optimize prior auth initiatives. We've also then, though, seen from CMS a directive to reduce the number of prior auths that are actually necessary, right? And there's a practice called gold carding, where in fact, based on a threshold that a provider has met with a certain procedure or medication that they've been approved time and time again, well, based on those approvals, that approval isn't necessary anymore. It can go straight through. It's no authorization necessary, right? Based on historical performance of approvals. So we're seeing many health plans now commit to that practice by way of being able to reduce the number of prior authorizations that are needed. But still, the mandate exists that you must meet provider-payer data exchange, payer-to-payer exchange, right? If a patient goes from one health plan to another, there has to be exchange of data that's seamless and smooth for that patient to just kick into their new health plan, if you will, right? With activities, benefits, enrollment, et cetera. We're then seeing from CMS, and I think CMS being the largest of our healthcare service providers, we're seeing then the directive around interoperability. They just released the healthcare connected ecosystem, right? CMS released that in an RFI. So what does that mean? How can healthcare become ever so more connected through ways of interoperability, to your point, right? Exchange of data between payer and provider, between provider and patient even, right? Or between patient back to provider, or member back to health plan. Patient empowerment is a key theme and central to that as well, right? How can we empower our patients with their own data to take care of themselves? And this holds true to me as a nurse. I think that's extraordinary, right? Giving patients the empowerment to care for themselves in a way that they hadn't before, because data can inform them in how to do so, right? So that is something that we're seeing as a directive from CMS, and that's going to trickle down, right, to our providers and our health plans. And then, as I said before, this whole initiative around digitizing quality. Quality initiatives have been manual, very much so. The reporting aspect, right? The closing gaps in care, it's very manual of a process. So how can we bring to light technologies like clinical quality language engines? That's an HL7 standard that expresses clinical logic in more real time, to surface gaps in care in more real time, to close those gaps, then real-time reporting on that data, right? That becomes priority in that it effectuates better health outcomes, right? So NCQA has put forward a mandate for digital quality reporting digital quality measures, come 2030, and CMS will likely follow suit with that mandate, not just for health plans to report on HEDIS, but also for providers reporting on ECQMs, electronic clinical quality measures.
So I was talking earlier about like sharing and common infrastructure for sharing. What are you seeing in terms of your clients? Are we getting to the point where there could be kind of, one leg to one leg, Microsoft to Microsoft, or Microsoft is the kind of the connective tissue in a lot of this sharing? Or what is evolving in that space, and what role is Microsoft playing from a physical infrastructure perspective?
I think we're the connective tissue because our FHIR APIs can connect with anything, right? With any other system platform. So there are no boundaries, if you will, and heighten with our security. So I think that there becomes a tremendous opportunity to build out those gateways, right? And then let's layer on ambient intelligence as we think about payer and provider data exchange, and how our ambient technologies can really help to facilitate workflows that could be more real time and reduce provider burden with the documentation element of things. So I think there's a tremendous opportunity there too. So
are you talking about a day in the future where I may not necessarily have to fill out the same intake form 15 times?
Yes.
All right. I love it. How much, where does kind of data sovereignty play into this? As me as the patient, are there talks from a kind of a regulatory perspective about kind of like my data sovereignty and what I own and what I can expose, and creating infrastructure so that I have more, you know what I'm getting at?
I do, and it's been a topic for a long time, a topic of discussion. I still think it it's to be solved. We here at Microsoft don't own any data. The data belongs to our customers, right? And as far as patient data, that's beyond our atmosphere, if you will, right? Because we're not interacting directly with patients. So we don't own our customers' data. So I think those decisions go back to the providers and the health plans and the directives that come down from CMS as around data sovereignty amongst patient sovereignty specifically.
Yeah, I'm interested in that one and see where that evolves over the years in terms of, my control over my data. It's been relevant in kind of consumer realms for a while, right? And this is Europe has kind of been leading the charge on this in terms of like you are able to control, your data. As we start more of the sharing in the healthcare space, particularly in the U.S., I think that this will be an evolving issue that we need to be mindful of as well.
Yeah, and there are levers, right? As we think about the security aspect with HIPAA, when we think about patient consent, right?
Yeah.
So I think those levers are in place, but to your point, it's a bigger conversation around the entirety of patient sovereignty around their data. Because data is stored in electronic health records, right, that are owned by our hospital systems, our healthcare systems. So I think it's a bigger conversation, to your point, that still needs a bigger answer.
Yeah. Let's transition into getting over towards the patient experience. I certainly want to talk about that. I hinted about that about my pithy comment about no intake forms, but that is a legitimate gripe.
Yes.
But I want to get into kind of some of the patient experience. But we were talking before about AI, and I had an interesting guest on the CDO Matters podcast earlier, and we were talking about some of the predictive things from a treatment and diagnostic perspective and the use of AI. And that really, really interests me. Because it starts to touch on some really amazing and some really powerful and maybe even some things of concern from a privacy perspective. Are you working at all with any clients in terms of like understanding and getting more predictive from a diagnostic perspective and getting into the realm of like, can we start to predict future events? And if we can, how do we deal with that? Are these conversations happening now?
The conversations are happening. There's research being done, but it's important to understand too that Microsoft, we do not diagnose, right? We're not in the business of diagnosing. That's for a physician to do, but we provide tools for clinical decision support, right? That brings up the aptitude for more accurate diagnosis, more predictive diagnosis, to your point. So, and this predictiveness around disease sequelae, if you will, or deterioration of disease has been around for some time as we think about the first use case around sepsis, right? So in many conditions, diseases have biomarkers where we can use those biomarkers to tell us more predictive insights going forward with that condition, with that disease.
Okay, so I appreciated the disclaimer there. That Microsoft is obviously not in the business of doing diagnostics. However, you are in the business of creating these incredible data layers where you'd be capturing a lot of the patient records, or you'd be capturing a lot of the interactions, bedside, physician's notes. It's all sitting there. To me, there is a wealth of data sitting there, and if you can figure out how to meaningfully connect it all, not just from the physical layer that I was talking about, but also that logical layer under common quality standards and definitions and those things. I'm like, wow, when we start to get into some of the predictive aspects here, I think there's some really, really amazing stuff. I mean, we've already kind of some of the maybe the DNA providers, have kind of hinted at some of this and doing advanced analytics on some of the genetic markers.
Yes.
For predispositions. I know I've subscribed to those.
Yep.
Those services in the past. I find them infinitely interesting. I just was more interested from more of a kind of some of the ethical potentially and kind of big brothery type things. It was just interested to see if people were actually having these conversations. I assume that they are happening.
They are happening for sure. And in my work with our health plan customers, we're seeing more uptick of use cases that revolve around a more predictive care journey, right, for care management, right, more predictive utilization management, if you will. So those workflows becoming more predictive overall, where in fact those nurses have the data that they need, they can have it at the point of care, right, to provide the more targeted intervention, and then have insight and fortitude to know what's going to happen next with that member, right? So they can be more prescriptive in their engagement with that member, if that makes sense.
No, it absolutely does. Even to me, I think of things simple, things like, especially as we age, like drug interactions.
Yeah.
Right. And some of the complexities there, and using AI to understand patterns that we may not have been able to see before. If patient X is taking these 4 meds and patient Y is taking those 4 plus 5 others, and understanding where there could be potential interactions that we haven't understood before, or understanding patterns that exist that we hadn't necessarily seen before. Like, to me, this starts getting into some really powerful stuff when you start talking about, predictions of outcomes.
Yes.
You agree?
Oh, I totally agree. Most definitely. And in the world of medicine, we're seeing more predictive disease models around nephrology for kidney, right, for kidney diagnosis, congestive heart failure, because again, it goes back to the biomarkers in which exist for these conditions, and being able to use those biomarkers for the trajectory of the disease and to be more predictive with the outcomes of that disease. So being able to have the foresight to understand that disease and the sequelae of that disease, and to intervene before the decompensation of an event, right?
So are you also working with public sector? Is that part of your remit? I know you've got public health in your title, so I assume you're also working with public sector entities in terms of them better kind of serving their serving the public when it comes to health outcomes, correct?
Well, that public sector meaning academic medical institutions, public sector meaning governments. So yes, to answer your question, yeah.
Yeah, all of the above. I just the reason why I asked, I had a conversation with a state agency responsible for public health, talking about how we do some of the things that we're talking about, how we actually develop some of these master data management capabilities, data quality capabilities, data infrastructure, and how we do these things. Seems to me like that, from a public health perspective, there could be some really awesome benefits here as well.
Most definitely, as we think about disease surveillance, right? As we think about pandemics and epidemics and the whole notion of how we could be more predictive with epidemiology as a whole, I think that's where, AI can really lean in on public health in a way that hasn't been orchestrated before. So, and a lot of learnings that came out of the COVID pandemic, right? In the way in which we could be more astute with vaccine enablement and disease surveillance, as I said before.
Got it. So I'll take a moment. I've noticed nobody's had any questions. This is some pretty complex stuff. If you are a data and analytics professional and you are in the healthcare space, or maybe thinking about going into the healthcare space, and you've got questions, please let us know. Feel free to drop them into the Q&A tab or the messages tab. I don't see any questions in either. And we also have a Q&A tab. So we have 3 ways to ask questions through our Goldcast platform here. Or if you are joining live through LinkedIn, which you may be as well, just drop a comment in. Through LinkedIn, and we will happily discuss it. Getting back to kind of patient experience and kind of the overall patient life cycle. Again, when I think about this, I think about kind of the patient record, the patient identity being kind of the core, right? Who am I? Who are the doctors that I see? Who are the doctors that I care to see? When it comes to that patient experience and me going to see a provider, what are some of the things that Microsoft is working on to enable to kind of smooth that process for your clients? What does that actually look like to have an improved patient experience, and what role are the systems and solutions that you're providing playing in that?
Yeah, and it goes back, I believe I said at the beginning, where in fact we're seeing an uptick of more member-facing digital applications, right? And ways in which we can use generative AI to create a more personalized experience for members, and ways in which then generative AI can lend that next best action to help orchestrate care, and even adding in agents to help orchestrate care, right? And navigate care for that patient, for that member, to get them to where they need to go based on preference, based on demographic, based on location, all of the above, right? So they can harness more of a personalized experience overall. And that's one example, and a brilliant example, I believe, as to how we can be more astute to provide a more personalized experience for patients, because patients are now informed. They know, there's so much information out there on the internet, where they're equipped to understand. I mean, just my mom, even, she's having problems with her ears, and she's been reading Google out the yin about her ears, and she's coming to the doctor with her own questions, right? It's a different relationship today, I believe, between physician and patient, where patients used to be where the physician would own the relationship in a way where they had all the information. Now patients are not as dumb, right? They know more about their own conditions, right? They've been reading about treatments and what's out there in terms of research and so forth. So we have to be able to meet in the middle with all of that information and ground it in true data, right? And ways in which both the provider and the patient are prepared to use that data, harness that data to present the better and most effective outcome.
When we were talking, doing kind of a prep for this session, and we were talking about this specific issue, I struck by the idea that this is becoming kind of more consumer driven, and I actually say that in a positive way. I don't mean that in like transactional, or like this is like a true consumer experience where I'm just going and buying something. But I do see this as being, healthcare embracing more of what people in like the CPG space and other, like the retail space, even travel, where you're trying to create this highly patient specific experience where there is a life cycle, where there is multiple touch points. That to me, like that is like a wow factor, because I can say from personal experience, it's where I've kind of gone in to kind of like a funnel, as it were, within a given provider, and not really treated as an individual, not really, it felt like I wasn't really kind of listened to, that I was just kind of being put through a grinder. And what you described is the complete opposite of that.
Right. Most definitely. And I think that physicians, providers really need to acknowledge about how much patients have upped the ante with their own health, right? And the whole notion too of that more personalized experience, but a more continuous relationship, right? Not so episodic in nature, I think is important as well, right? You might see your primary care physician twice a year. Why is that? Why can't there be more interaction throughout the entire year about your health, right? And that's another, I think, aspect of a more personalized experience. Just something to think about for the future.
Or instead of being so reactive, try to be more proactive and more a part of like kind of everyday life, which I suspect is how things kind of were decades ago, when you had family physicians and when you had kind of the physicians were in your community. My grandfather was a small town dentist who went with his bag from door to door. He was doing dentistry in people's kitchens.
Yes.
Not saying that should happen anymore.
Yeah.
but that's a totally different experience. And I hope we can get there. But of course, we live and breathe in data. And again, getting back to this idea of a foundation. If you don't know that John Smith and Jonathan Smith are two different people, if you don't have a solid foundation of kind of trusted, curated, high quality data, whatever you try to automate on top of that, you're going to run into a lot of problems. We got Sherry on LinkedIn ask a question. This is a few minutes ago. I think this is probably getting back to some of the things that we were talking about in AI and getting predictive. Sherry asked, and I'm kind of putting a little bit of words in your mouth, Sherry, so forgive me, but what are some of the risks that might be associated with kind of AI getting a little more predictive, doing some of the things that we were talking to? I mean, I used the big brother phrase. Yeah. What are those risks, and how do we mitigate them?
Yeah, so you had mentioned one, hallucinations, that presents a risk. Bias presents a risk, right? There's constant research on both of those domains, if you will, here at Microsoft. And we have a framework around ethical AI. So we try to reduce the amount of bias, right, that could exist for AI, and working with our customers in a way to promote that governance at their organizations. So those are two of the risks I essentially think about, when I think about AI as a whole. I think that too, it's upon us to upskill the community that is using AI to really understand the ways in which it should be used as a tool, right? It's not there to replace critical thinking, it's there to enhance critical thinking. So I think that's really important as well, especially as we think about healthcare professionals, right? And I think that there could be risks in any type of model that's created, just by way of virtue of the amount of data that's there, the volume of data, the accuracy of the data, to your point, right? So that master data management becomes even more imperative as we think about mitigating risks around that.
Yeah. Lots to think about there. We are approaching a brave new world. There's a lot of really difficult challenges. The kind of some of the ethical and bias challenges as data practitioners. Those are really hard questions, I think, to answer. Certainly, having great tools and great partners in companies like Microsoft and Profisee can help you along the way. But in many ways, I do know for a fact that a lot of practitioners are figuring this out on the fly as we go, right? And we're figuring out as we go, because we're so early in this. So take comfort in knowing we don't have all the answers yet. That is also a little scary, but we're figuring out things quickly, I would say. Now, there's another question from, want to make sure, forgive me, from Musa. Asks, healthcare is, and I think this one's probably maybe for me, if that's okay, Amy. Healthcare has many master data domains: patients, providers, facilities, devices, clinical trials, on and on. How would you advise prioritizing which domain to prioritize first for maximum impact? So my recommendation there, Musa, is not. This is going to sound a little heretical. This is kind of against the kind of the many approaches that are advocated out there. I would recommend more of a process-based approach to MDM and not a domain-driven approach. What do I mean by that? Start with an outcome that is a high priority outcome. You've heard Dr. Berk talk about some of them. Maybe improving your patient experience, maybe addressing a problem like patient leakage within your network, maybe addressing a problem like creating a provider catalog of all of your providers. Maybe it's something as simple as having a patient-facing portal where you can go and access information about your providers. Pick a business outcome that is meaningful to the business, and then solve the MDM problem needed to enable that outcome. When we think about domains are relevant to us because we're data people, right? There's patients in the patient table and there's providers in the provider table. But really what our patients need and what our providers and what our companies need is excellence in those processes. We need excellence in all the things that I was just talking about. Maybe it's patient onboarding. I could keep going on. What I would recommend from an MDM perspective is that you focus on one of those processes. Try to keep it as small as you can. Try to keep it as contained as you can, but where the delivery of value is intrinsic to the things that you're doing, so that you can say, after you've done it, after you have stood up an MDM that is enabling a patient onboarding process or that is addressing a patient leakage problem, that you'd be able to say, aha, here's where we were. Here's where we are. We've delivered tangible value. We've improved the patient experience. We can prove it, and then do it again. Do it again, and then do it again. Kind of take an MVP approach to solving for MDM instead of looking at just domains. Because when we look just at a domain and say, okay, we want to make the data better in the patient table, that's great. But patients are experiencing things outside of a table. They're experiencing an entire workflow, an entire process. And that's what I would recommend you focus on, is more of a process-based approach instead of domain-focused approach. I don't know, Amy, if you've got anything to add on top of that.
No, I think you said it best. I think too that, you have to go back to the business priorities of the organization with which you're in, right? And always regulatory. I mean, you have to look at regulatory mandates first and foremost. You have to meet those as an obligation. And then what you're able to handle in terms of the data in which you have, the management of the data, how scalable it is becomes another imperative, right? And I think that being able to align the volume of data with these priorities and getting back to that MDM element to manage all that data will give you insights as to what you can do first, second, and third, if you will, as to how you prioritize, right? I think that's important too, considering the volume and the scalability of data too.
Yeah, you mentioned the regulatory aspects here. To me, that's kind of like the minimum bar.
Yeah,
it's kind of like the double charge.
Exactly
as it were, to get into Club MDM, the minimum bar here, or Club One Lake or whatever, pick your metaphor, Club Fabric. You've got to get. I mean, you've got to clear the regulatory hurdles. That kind of is the minimum bar. Again, most certainly MDM can help with that. I did appreciate the comment. Thank you. My UI is acting a little crazy. Thank you, Musa, for the comment. Musa says, I don't know how things are around the world, but here our healthcare data is a complete big old mess. Nobody wants to deal with it. Maybe I'm looking at magic. Well, it's not magic. It's just hard work.
Yeah.
Well, but it's a lot of work.
If I may, my doctorate was on really in ways in which bridging the data gap in terms of data literacy and utilization amongst nurses. And we have so much data out there, but there's really no guide as to how to use that data in the most effective manner, right? And I think that presents challenges where, in fact, organizations are somewhat learning as they go, right? So why isn't data informatics more entrenched in a competency versus just something that we do, right? I'm all for that, right? Ways in which we can more formally educate our providers, our nurses, right? Physicians, nurses, business administrators, how to effectively use data to really present forward the outcomes in which we want to achieve, right?
Well, I think part of the problem here, I've been having this conversation in many ways across the last few months. And I think part of the problem here is when we treat data as a separate thing, right? And anytime we treat something as a separate thing is when I think silos begin to form, is when we have maybe a nurse who doesn't necessarily need, or thinks she doesn't, or he doesn't need to care about data, or you have an MD doesn't necessarily need to care, and where data is the separate thing. It's this in the different department that somebody else worries about. What you just said is, how do we integrate these things
into workflow?
Right. How do we better integrate them? There's certainly a story to be told here from like a plumbing perspective, like a physical infrastructure perspective. I was talking about that. Microsoft and Profisee most certainly can help. But Dr. Berk, what you're really talking about is more of a kind of a how we do our jobs issue than it is about a plumbing issue. And this is something that I see across the board. This isn't unique to healthcare. This is why so many companies struggle with data governance, is because they think data is another thing. It's a different thing in a different department.
That's exactly right. And it is imperative that we utilize data today. It is the currency of healthcare, if you think about it, right? Nothing can be done without data in an effective way. So, I think our organizations are learning the importance of data and creating that infrastructure that's going to enable data to persist and then be utilized in a way that's effective. But it's a steep learning curve. There's still a steep learning curve out there, right? And just by the way, I put in the chat, there's an article in the New England Journal of Medicine that was written by some of our leadership here at Microsoft, Peter Durlock and Dr. David Rue specifically, that is a maturity roadmap for AI. It becomes a framework for effective and sustainable AI in healthcare. I would encourage everybody on this podcast to take a look at that, because it really does talk through how we could stand up a framework, right, with the right data governance and reduce the bias and the hallucinations that are associated, right, as risks with data, and how to mitigate through those, hence the framework that's presented. So I would encourage people to take a look at that.
Thank you so much. Kayla, if you could drop that into the LinkedIn chat, that would be helpful. Thank you. Getting back to the previous discussion about kind of integrating data into everything that we do, there's a lot of talk these days about, data culture, becoming more data driven. But when I think about these things, I think about the role as that we may have as technology providers. Maybe you're on this podcast and you are a consultant. Maybe you work in a data and analytics role within a healthcare provider. I see a huge opportunity for all of us to become more consultative, right? Like to become more like Dr. Berk. Maybe kind of like that's what I do. I'm kind of doing the same thing. I'm evangelizing MDM and data. But within all of our roles, to find a way to be a little bit more consultative. Yes, I think there's going to be formal training programs. There's data literacy programs. There's formalized things that we certainly can do. But there's a lot of people concerned about, well, how is my job going to be affected by AI? People, I don't think, at least maybe not my lifetime, are immediately going to shift and say, I prefer to have a conversation about complex things with a robot versus somebody that I trust and somebody that I view as a trusted advisor in the organization. So I would recommend to anybody, try to find ways to be more of a consultant, try to become ways of becoming a trusted advisor, so you can be there to have the conversation with that nurse or that other practitioner about how they can leverage data better day in and day out. What do you think, Dr. Berk?
No, I'd agree with you. And I think too, the forthcoming agentic world, if you will, right? We're moving towards agentic AI, and it's going to be imperative as to how to orchestrate all those agents in an environment in any organization. So I think the upskilling around that too becomes essential as we think about this next generation of an organization with agentic AI at its forefront.
Yeah, one way to think about that, we've been using the phrase agentic for a while, and we recently within Profisee just released an agent. Her name is AZ. I don't know. I've feminized her. I think it could be but the way that we look at this, and I see this as a metaphor as to how things are evolving in healthcare as well, is that this kind of help agent is way more than a help agent. It's more of like an orchestrator. And you had mentioned tumor boards, and I've seen some demos from Microsoft that were like so powerful, where there is like an orchestrator type agent that is working with other agents who are more specialized.
Yes.
Right? Maybe a diagnostic agent. Maybe there is a pathology agent. Who knows? But it may be a useful way to think about this is this digital team. Yes. Right? This like a digital org chart with an orchestrator on the top and these agents that are part of this digital healthcare team for you. And when I start to think about things that way, like, I don't know, lights start to go off. I don't know, maybe it's just me when I think about, agent, that's the chat bot that's trying to upsell me something. But when you view it as more of a healthcare team, right, that you can access through tools that you use every day, like Teams, that's pretty slick.
It is. And that is, we're taking a frontier firm approach, if you will, here at Microsoft, where we want organizations to evolve their AI, because as I said before, organizations are all at a different place in their maturity around AI, right? And that multi-orchestration of agents is the North Star, right, around having various agents doing various activities, right, and creating that multi-agent environment.
Yeah. So we had a comment from Curtis. The goal of MDM isn't to be good at MDM; it's to create reliable data to solve actual business problems. Sing it from the mountaintops. I'm with you on that one, Curtis. The goal of MDM is not to make data better per se. Well, I mean, it is. But the real value of MDM is going to be in those business outcomes that we talk about. That's another way that we as data people can change how we talk about data, right? Instead of talking about the data being better, talk about the patient experience being better. Talk about reducing patient leakage. Talk about payments happening faster between payer and providers. So talking in the business language is something I absolutely recommend. That's going to get us closer to those providers because we'll be speaking in their language instead of speaking in data. Murad, another question. Before talking about MDM, the data strategy should be clear and aligned to needs of the enterprise in terms of the goals of regulatory. Yes.
Yes.
Don't do MDM for MDM's sake. Don't do anything data. I mean, you should be aligned to some overall strategy. Again, I use the pithy comment of a regulatory should be the cover charge. Should be the the baseline, assuming that everything you're doing is within some broader strategic framework that your organization has passed down. Agreed. Yeah, totally agree. Yes. That is to say, if I used to, when in previous life when I was an analyst, I would hear all the time, well, we don't have a strategy. I think you probably do. It may not be communicated very well, and it may not be advertised as well as it probably could be, but there's probably a strategy out there. Everybody's got a strategy. So with our last few minutes, Dr. Berk, what are some things that we didn't talk about? What are things that data professionals in the healthcare space maybe need to think about? We talked about AI, we talked about kind of patient experience. We didn't really get into value-based care very much. Is there anything that we could be talking about in our last few minutes that you find interesting?
Well, I think the focus on interoperability is one that we need to be paying attention to. Interoperability has been around for some time, right? The NIN way back when in 2010, I think that was when the Standards and Interoperability Framework for the National Health Information Infrastructure Network. But it has evolved, and we're seeing the uprise of TEFCA and QHINs and so forth, right? Epic has now a paid platform. Cerner has iOS, or Oracle Cerner iOS. Interoperability is the priority for CMS, as I mentioned before, that interconnected healthcare ecosystem, right? So looking at FHIR and bulk FHIR and ways in which to exchange data in the most seamless capacity, in an accurate capacity, to your point, Malcolm, right? These are all very important, and it's the conduit to the bridge, if you will, to expose on initiatives around value-based care as we think about payment integrity, as we think about care coordination, as we think about closing gaps in care, hence, as I said before, risk adjustment. It empowers multiple use cases, interoperability does, digital quality. So I think that, a focus on interoperability and the normalizing, the aggregation, the preparing of the data for that interoperable gateway, if you will, becomes imperative. And I think MDM can help with that a lot.
Well, most certainly. This gets back to something I talked about before, and maybe a useful metaphor here. I've used this in the past. Is that some of the standards that you're talking about? FHIR, for example. There are others out there, but some of the standards that kind of establish common frameworks within this industry are necessary and important and are fantastic. But where MDM plays is at more of a conceptual or logical level. Meaning you can have a framework for sharing patient data and say, this is how wide this field should be. And we should expect to see characters here and integers over here. And this is the standard for exchange of data. That's great and necessary. But if you've got John Smith, Jonathan Smith, and J.M. Smith, right? And you don't know if that's one person or if that's three people, that's the problem that MDM exists to solve. And it is the combination of those things. It's the whole layer cake that I was talking about before. It is this logical layer that is going to help you understand if I have one patient or three patients integrated with that connective tissue that is increasingly going to be provided by Microsoft through amazing technologies like OneLake and Fabric. It's the connection of the two that is better together. And you can have an amazing set of plumbing to allow this interconnectedness. But if you're sending two patient records across the line when there really should only be one, that's going to be a problem. That's the problem that Profisee exists to solve, I should say. So in our final 2 minutes, Dr. Berk, thank you so much. And by the way, congratulations on your recent PhD.
Thank you. I appreciate that. Thank you so much. I'm really excited for what the world holds for, my work in data informatics and ways in which we can better understand data to effectuate on health outcomes, right? I think that is imperative, and the ways in which we can really extend that to even our patients out there, right? And empowering them with their own data to help their own conditions to be more astute with prevention and longevity for their health. So I think that's the priority, at least for me it is. So.
I love it. What's a good way to connect with you and others at Microsoft if people are interested in learning more?
Connect with me on LinkedIn. Or you can send me an email directly. I'll put my email here in the chat. I'd love to hear from you. And I'm always here to be of help. I think that's the
Wonderful.
best way. So
thank you. And in terms of me, well, if you're listening to CDO Matters Live, maybe this is your first time. If it is your first time, we do this once a month, typically the third Friday of every month, but we also have a recorded version of the CDO Matters podcast that we release every 2 weeks. We're talking to data leaders, data practitioners about the things that matter the most in the world of data and analytics. We're talking a lot about AI. We're talking about data management, master data management, quality, strategy, you name it. We're talking about the things that matter the most to CDOs. I would love if you join this growing community of data practitioners. And I hope to see you on another live episode next month. We'll probably do this the third week of September. For now, thank you so much again, Dr. Berk, and thanks for everybody for joining us today. Have a wonderful weekend. We'll see you again sometime very soon. Bye for now.
Thank you. Bye-bye.